So today we're going to talk about Pes Anserine Bursitis. So anytime a patient comes in with medial or inside knee pain, we want to consider if it's a possibility that it could be Pes Anserine Bursitis. So what the Pes Anserine Bursitis is you have a bursa sac filled with fluid that is sandwiched between the tendons of your sartorius muscle, your gracilis, and then one of your hamstring semitendinosus muscles, and it's sandwiched between those tendons where they conjoin and your tibia, so your leg bone. And what this bursa does is it reduces friction between those two. So what can happen is you can get irritation of that bursa or increased excessive fluid. So what happens with this bursitis is you get irritation, excess irritation and fluid buildup of this synovial fluid sac, and you can get increased inflammation in that area and pain in especially that medial middle inside knee. So things like trauma, repetitive movements, or even degeneration can cause that increase of fluid and inflammation in the area. A lot of times it is not just alone. So what that means is we oftentimes will have increased irritation here because we have tight hamstrings or tight calves or weak hip adductors. So those are some things that we will address in the office to, of course, find out why you're having this Pes Anserine bursitis and how we can fix it so that you're not having, recurrent flare-ups. Some risk factors that put you at risk for having Pes Anserine bursitis is obesity, so being overweight, having diabetes, and then as well as just being a woman, you are more inclined to get this just due to how we have wider hips and our knee, the angle of our knees kind of go in a little bit more compared to the male. So also functional risk factors like tight hamstrings, tight calves, and then if you are an athlete who does a lot of side-to-side, so football, soccer, baseball, things like that, you're more at risk to developing this Pes Anserine bursitis. So if you have Pes Anserine bursitis, some of the symptoms that you'll feel is pain in the inside knee, kind of below the joint line. So you'll feel it kind of into this area below where that knee bends. You can have some swelling, and you'll have pain that is made worse when you're going up and down stairs, as well as getting in and out of a chair. So walking on flat surfaces typically does not bother it, but sometimes going side to side can irritate it as well. So once we identify that this is the area that is bothering you, some things that we'll do in the office is, of course, work on decreasing some of that inflammation, improving flexibility in the hamstring or in the calf, so doing some muscle work to reduce some of that tightness, and then working on some of the joints of the knee, the ankle, and the hip, making sure everything is moving like it needs to, and then building in some of that strength, again, in the hip flexor and in some of those areas to prevent further episodes of your knee pain. experiencing inside or medial knee pain, it could be Pes Anserine Bursitis, and we would love to help. So give us a call at 513-463-3011.